So good afternoon, everybody, and welcome to the second of our monthly Community Mental Health Transformation webinars. I'm Megan G, the Communications Manager for the programme. It's lovely to see you all this morning, and got a flurry of people still joining, so that's really, really good to see. Just a very quick bit of housekeeping before we get started. If you wanted to turn on subtitles, if you go to the bottom of the Zoom screen, there are three white dots on the bottom right hand side. If you click those, you can then turn on live captions, if that is helpful. And just another couple of bits, we're going to be sending out an email later today just with a summary of what's been covered in the webinar, as well as a link to a short survey for you to complete, just to let us know if there's anything that we could do to make these even better for you all. And we really encourage you to share that email far and wide with anybody that wasn't able to join the webinar today. We'll also be recording it, which will be made available on the Community Transformation web pages, which will also be linked in the email. And then lastly, we will be doing 15 minutes worth of Q&A at the end of the session. So there'll be a 30-minute presentation and 15 minutes for questions and answers. So throughout the presentation, if you do have any questions that spring to mind, if you put them in the Q&A chat box that will be at the bottom of your screen, we'll then be able to run through those at the end. So I'm now going to hand over to Anne and Jenny to introduce themselves, and then we'll get started with the presentation.
Hi everybody, I'm Anne Foster. I'm the Head of Mental Health Commissioning for NHS Sussex.
Hello everyone, I'm Jenny Edge. I'm the General Manager for the Emotional Wellbeing Service developments across Sussex.
Thank you. So we've got a few slides for you. So Jenny and I are going to kick off talking through some of the background to what's happening, what's actually been going on in Sussex. And then at the end, there's plenty of opportunity to ask questions and for us to answer as best we can. So we're going to be talking to you today about the Emotional Wellbeing Service, but just to give you a little bit of background to what that's about. So nationally, across the country, there's a programme to transform community mental health services for adults and older adults. So what we're doing in Sussex, you'll see every area across the country is actually doing at the same time. So essentially, what is this all about? So at the moment, I think we've got a system that's actually quite siloed, quite complex. We've got multiple individual services that don't always connect, and they don't always holistically meet the needs of the service user. So the idea is to turn things on its head. So moving away from these individual services with criteria that don't always best meet the needs of individuals, particularly for individuals with more than one need, people with complex need. The current system doesn't always serve them well. We have clinical services, we have community and voluntary services. They don't always connect. And we don't always think about addressing those really important social determinants of health that might impact on someone's mental health. So thinking about how we connect debt advice, employment advice, all of those sorts of really important things that can impact on someone's mental health. Trauma informed, I think some of our system is very trauma informed, but there's scope to do much more and really think about how a trauma informed approach across the system can really help improve the mental health of our population. Thinking about prevention too, that's really, really important. So often people present into the system when they're in crisis because they haven't been able to get the help early enough. So the idea is to have a really strong focus on prevention. And the idea that this transformation is based around local neighbourhoods. So it's based in the communities in which people lived. And within Sussex, we're using our primary care network, so our groups of GPs working together as the basis for our neighbourhood population. So these are things that are easy to say. I think we can all envisage how we might like things to be better for those users of services. but it's quite complex. It requires a huge degree of collaborative working between partners. So be that mental health services, primary care, general practice, community and voluntary sector, social care, and really important, experts by experience. So people who've got experience of using the services. Thank you. Thanks. So what you can see here on this slide are just some of the feedback that we've had on the system as we've seen it, just to illustrate some of the points that I was making. So services need to be more trauma informed and culturally aware. That's really important. There are gaps between services, different thresholds, meaning sometimes referrals bounce between different services, particularly between primary care and the community and voluntary sector. Primary care often feeling like they're holding risk. Need for greater flexibility. We've got very much a one-size-fits-all approach, and actually that doesn't serve well all of our population. We don't have enough psychology or therapeutic intervention. That comes up consistently. And quite often the support that is available is time limited, and that presents challenges for people who are often living lifelong with mental health conditions. So we need more flexibility to support some of these people. I think a lack of connect also between mental health and community and voluntary sector. And a big theme that's come through is that we have a really vibrant community and voluntary sector in Sussex, and actually we're not utilising them to the full potential. So that's just to give you a bit of a flavour of some of the things that people are saying about our current system of care, just to give you a bit of context to what we're talking about. So within Sussex, so we've got a vision, we can all think about what could be better. So the approach that we've taken in Sussex is really to start small. So the first phase was last year. What we had last year was 9 what we called accelerator PCN sites. So there were these 9 PCNs who started to work with us to test out the model. So what we developed was fairly small scale multi-agency emotional wellbeing teams. So they consisted of mental health practitioners who were employed by SPFT. And then we had support coordinators who were employed by the community and voluntary sector. But I think the key thing to note is the mental health system overall remains unchanged. So all of the services that were already there are still there. These are new small teams in addition to what's already there. So that's what we did last year. And then this year, what we've been doing is rolling out that entire model to all PCNs across Sussex. And going forward, and I'll talk a bit further about this at the end of the presentation, the idea is really to build on this model. So expand the staffing mixing the teams, look at some additional resources, particularly to address where there are gaps in provision, but also think about how we redesign the current system. So I'm going to hand over now to Jenny, and she's going to talk to you about some of the detail about what's been going on for emotional wellbeing services in Sussex.
So I'm going to pick up where I left off. So it's part of an evolving service. So this is the what is the Emotional Wellbeing Service, and it forms the foundation of community mental health transformation and the beginnings of the integration of the community mental health service. So it forms part of the primary care network service for patients that are aged 18 or over, and it's really aimed at people that frequently use appointments in surgery, but primarily for support with their mental health. And it provides focused support and helps ease the additional demand for GPs and practice clinicians. It's specifically for patients with mental health needs who are not currently under the care of community mental health services, and they wouldn't meet the criteria for assessment and treatment services offered by Sussex Partnership or IAP psychological therapies. And it's got a focus on people that have more serious mental health illness, so SMI. It provides easy access to short-term focused support, and the referrals can be sent direct from doctors and practice clinicians in surgery to the service. Thank you. So this just gives you an overview of the pathway. So it guides you through the patient journey from the patient contacting the GP surgery then identifying that this person is presenting with a mental health issue and that they wouldn't be able to access the other mental health services which Anne referred to, that all remain in place. So ATS, IAP services, they're still available. People who would benefit from those services should be referred there. But for other people, they can be then referred through to the Emotional Wellbeing Service, to the voluntary sector mental health support coordinator to actually respond to that initial referral. Then the mental health support coordinator provides support, short-term support of up to 6 sessions, and then the mental health support coordinator sessions finish. The important aspect of this service is that people aren't discharged in the formal sense from the service. Support will end, but people can come back to the service at any point if their needs re-emerge. And you can see from the 2 blue boxes that are either side of the mental health support coordinator support, that on the left-hand side, this is the route where the mental health support coordinators can refer direct to the mental health practitioner. That's the Sussex Partnership clinician. There's no complicated referral pathway to access the clinician. This is a member of staff that works alongside them. They know very well that is part of the Emotional Wellbeing Service team. And then on the right-hand side, if the person would benefit from access to other services, then the mental health support coordinator from triage can actually take that person to the multi-agency triage hub in that locality for access to an alternative service, so that the patient doesn't experience moving between services, but it's all done very smoothly within the Emotional Wellbeing Service. Thank you. And this is just to give you an overview of where we are in terms of PCN Emotional Wellbeing Service developments, starting from 2021-22 and moving into this year. So under the green box at the top, we have 6 PCNs in total in Brighton and Hove. 3 PCNs were part of the Accelerator programme. One of those PCNs is paused currently, so 2 PCNs, the service, as I've just described, is live. In West Sussex, there are 21 PCNs. 4 PCNs were part of the Accelerator Wave 2. And one of those services is just in the process of remobilising. 3 are currently live, and we're receiving some very positive feedback from the PCNs about how those services are working. In East Sussex, we have 12 PCNs. 2 of those PCNs were Accelerator sites, and those 2 PCNs have a service that's live. The remaining PCNs, so the next wave of mobilisation, just to give you an update of where we are with that. In Brighton and Hove, the further 2 PCNs are in the process of recruiting staff, or they have recruited staff. So, and when I'm referring to staff being in the process of recruited, we've actually recruited members of staff and they're going through the pre-employment checks for those 2 PCNs. In West Sussex, we have a further 12 PCNs where staff have been recruited and are going through pre-employment checks. And with the VCSE providers, those roles are out to recruitment and advert currently. So that leaves in West Sussex a remaining 5 PCNs where the recruitment and the process of beginnings of the Emotional Wellbeing Service is yet to start. In East Sussex, we have a further 4 PCNs where staff have been recruited and they're going through pre-employment checks. That's the SPFT clinical staff, and for the voluntary sector staff, those roles are out to advert and they're being recruited to. So in East Sussex, that leaves a further 6 PCNs where recruitment is yet to begin. Thank you. And just to give you some information about the role of the SPFT mental health practitioner. So the most important thing to highlight is this is a direct access route to a clinician via the voluntary sector mental health support coordinators. So there is no need for a separate GP referral or a referral from a practice clinician. It's all followed through from within the emotional wellbeing service by those voluntary sector members of staff. And the mental health practitioner is a qualified SPFT clinician, so that would be a mental health nurse, occupational therapist or social worker. They can provide clinical consultation, advice and guidance to the voluntary sector mental health support coordinators. They provide one-to-one interventions and workshops as required, and they provide pathways to SPFT specialist services as needed by the patient. They also offer a reflective practice space for the voluntary sector mental health support coordinators, and also where there are social prescribers that are present within PCNs, we also offer that reflective practice to those members of staff, because there's strong partnership working that occurs between those members of staff. So this is an opportunity to really maximise that. And in terms of future developments, what we'd be looking to do is to introduce varied clinical roles to form part of a PCN multidisciplinary team. At the moment, those mental health practitioner roles are all band 6 clinicians, but we'd be looking to introduce varied roles depending on the population needs of the particular PCN involved. Thank you. And the mental health support coordinators, so what they provide is advice, information and supported signposting. They offer targeted, time-limited one-to-one support. They also provide a connection to other mental health support that's available and wider community services, which is really important for people's ongoing recovery. And as I've described, they have direct access to the SPFT clinician if that's required. And the future developments in terms of the voluntary sector roles would be to include varied non-clinical roles and varied VCSE providers within that. Thank you. And, just to give you some feedback, we recently held an event, this was last week, for the emotional wellbeing services that are up and running to reflect and build on the work that's happened so far. So we brought together emotional wellbeing service staff, so that was the VCSE, Sussex Partnership across Sussex, and we also had representatives from the SPFT ATS teams. We had 23 staff in total that attended. We were also aware that we really wanted to gather in feedback from the PCNs where the services are mobilised, but we recognised that for PCN colleagues to be able to attend the workshop, which was a full day event, would be really challenging. So what we did is we designed a survey so that we could gather in the feedback from PCNs. We could include it in the day, but bearing in mind the availability of the staff from the surgeries. We'll be presenting the outcomes from the day, and that will be shared widely. And we'll also use those outcomes to feed into the place-based planning for the first wave integration sites and beyond, so that we don't lose the learning in terms of what's worked well and what we want to build on, and also some of the challenges that have been faced and how can we can continue to develop the emotional wellbeing service and improve on what we've already started. Thank you.
Thank you, Jenny. I'm going to pick up from here and just wrap up with some final things and just think a little bit about the future and where we're going with the integration. So in addition to the workshop that Jenny's mentioned, which was specifically for the PCNs, we had some broader integration workshops this autumn. So we had one in each of the 3 areas, so East Sussex, West Sussex and Brighton and Hove. So these were really well attended events, people from across the system really coming together in a way for the first time, I think, partly because we started this transformation during COVID. There was not lots of opportunity at the very beginning to get face-to-face, but it was fantastic. I think each of the 3 workshops were really well received. So some of the things that came up, and some of this I'm sure many of you will know, but just to reiterate, I think the system as we have it at the moment has got many boundaries and exclusion criteria. So actually that means for quite a lot of people, they're not always getting the support until crisis point. The system is not well set up for people with multiple needs, and care is not always holistic. And the way that we work in terms of referrals and re-referrals is actually quite complex, and it's quite time consuming, particularly for GPs and clinicians, particularly with an SPFT, having to assess each time an individual comes through. And of course that referral and re-referral, if somebody's needs doesn't fit a particular service, quite often the referral then bounces back to a GP, and that's obviously really traumatic for service users. So the system is not ideal at the moment. So that's just to give you a sense of this, the themes that have come out. But I think from each of those 3 workshops, what's happened, each of the 3 areas have developed action plans to really drive the next phase of transformation work. If you think back to the beginning where I talked about the kind of 3 years, the 3 phases that we were going through, next year is where we're going to be building on the work that we've started over the last sort of 18 months, developing fairly small scale emotional wellbeing service teams, and actually really develop further. So the action plans have got very much a mixture of things that needs to be done in each of the 3 places, but there are also some Sussex-wide things that we'll be doing, so things that could be best done once. So there will be a mixture of things going on, and a huge amount of work over the next year really to drive forward that next phase. Thank you. And then just to think a little bit about some of the challenges that we found so far whilst doing that. We've made really great progress with what we've been doing, but it hasn't been easy. I think this sort of system change is really quite challenging and complicated. It requires a lot of collaboration. So they're different organisations who have quite different cultures, ways of doing things. And I always think of it, you know, the 3 key players in terms of provision are primary care, so GP practices, and there are no 2 GP practices that are the same. They are all different. We have Sussex Partnership, a big organisation across Sussex, and we have community and voluntary sector. Again, many different organisations across Sussex. So actually bringing together all these different organisations actually requires a lot of collaboration, understanding of each other and ways of doing things. So that's been a really important lesson. I think we've been trying to transform the offer while still doing the day job. So of course people still have to be able to have access to the current services. So many of the people involved want to transform services are still responsible for delivering services. So that's actually been quite challenging. And of course, the backdrop to all of this, I think everybody working with mental health knows, is just the increasing demand for our services. So the waiting list, we all know that. So we've been trying to do this quite complex transformational piece alongside that backdrop of increasing demand and of course workforce shortages, challenging to recruit to many new posts, in particular clinical posts, the pressure that creates on existing staff and the impact on retention. Some of the other things that have been challenges around this idea that we have a new holistic model based in primary care network. Actually, we've got a real limitation in some places around estates. So there's lots of opportunities there to think differently about what we do. So it's easy to say have a neighbourhood service, but actually we've got to have buildings so people can come together. And the last one, I'm not going to dwell on this, digital solutions. So of course, if we're talking about a holistic model, different organisations, we've got to be able to have the digital solutions so we can connect, so organisations can talk to each other, and we're certainly not there yet. And this is not just a Sussex problem, this is an issue across the country. And actually this can really hamper people working together, because actually we can't communicate, we don't necessarily know what one organisation has done or another. So that's just to give a sense of some of the kind of challenges that we've experienced so far, and some of the things that we'll be learning from in the future. Thank you. Okay, and just this is the final slide. So just to summarise, really, as we go forward, we're really going to be building on this emotional wellbeing service model, learning from that. It's an iterative approach. That's the whole point of it. We're starting small, we're learning, we're building, we see what works. And it's not a one size fits all. We found different GP practices, different PCNs want to work in different ways, and we need to be flexible enough to achieve that. We're thinking about introducing new roles, so thinking about growing the workforce for the future. Jenny mentioned the Band 6 clinical roles. We've got to have an eye for the future. Difficulties in recruiting clinical posts, so thinking about Band 5 clinical posts to grow the future workforce. We've also got to address the gaps in provision. I'm sure many of us know there are lots of gaps, just highlighted a couple: psychological practitioners, mental health pharmacies. So we really need to think how we fill some of those gaps to develop the holistic model. We want to build on this really important partnership with the community and voluntary sector, and think about how additional non-clinical roles can be really useful, essential almost now in the system in expanding the offer. So building on the teams, having fully integrated teams at PCN level with these pathways into SPFT specialist services, thinking about how we don't just have these new small teams, how we bring together with the resource in the system, so redesign of some of the existing services. Thinking about multi-agency access points, health and wellbeing hubs. There's all sorts of things to consider. So it feels really, really exciting doing all of this. It's big, it's huge, it's complicated, it's not easy. But I think actually the work that we've done so far over the last 18 months is really a lot of learning and given us a kind of a good foundation to move ahead. So I will stop talking now, and I think we get into the question and answer session, Megan.
Thank you so much, Anne and Jenny. There's been a flurry of questions coming in, so I think people have really enjoyed your presentation. Before we get into the questions, I just wanted to flag that the next webinar will take place on Wednesday, the 18th of January at midday. So in the email that you receive later on today with the link to the survey and the summary of this, there'll also be the link for you to be able to sign up for the next one. So hopefully you will be able to join us then. So let's get on to the Q&A. There's been lots of questions coming in, so if anybody does have any more questions, please keep them coming. We've got just shy of 15 minutes, so we'll try and get through as many as we can. The first one is more of a comment than a question. They just wanted to say that it's great to see that trauma-informed care and practice is being flagged, along with the emphasis on collaborative working. So that's really, really great. Thank you for sending that comment in. And a couple of people have asked just for a little bit of clarification around why somebody with a serious mental illness wouldn't necessarily qualify for SPFT services or for IAPT. So is it possible just to explain a little bit why that would be?
Yes, shall I respond to that, Anne? Lovely. Yes. There are many people with an SMI diagnosis that may actually be in a state of relative stability in terms of their mental health. So for those people, they don't really require the specialist services of ATS, but they would benefit from mental health support. So it's really for those people who've got a stable SMI presentation, but they may be prone to relapse, so that they can access this service very easily when they don't require the specialist intervention of the ATS. And in terms of the IAP service, there are some people with an SMI that's more complex than the IAP service would be able to respond to. So within the EWS service, there aren't those same referral exclusions. So they could actually access a service via their emotional wellbeing service where they wouldn't be able to access IAP service, or what's available through an IAP service wouldn't be the most appropriate intervention for them. So it's providing an alternative for people that wouldn't be able to access those services. Hope that responds to that question.
Great, thank you, Jenny. Just a comment here from somebody saying that what we've been discussing today is exceptional, and it approaches from every angle what this person has been hearing from within their communities. So that's really, really great. So thank you for that comment. A couple of questions have come in around how we are involving service users and carers in the design of EWS and within our transformed services. So would it be possible to speak a little bit around that?
Yep. Do you want me to answer that? I'm going to answer it very much from a Brighton and Hove perspective, just because I work in Brighton and Hove, so I know the detail. So this whole transformation is about co-production. If you can see, what we're trying to do is really design care around the user, what the user needs, and the system we've got is not really based around the user's needs. It's what's just grown up historically and what we've been left with. So within Brighton and Hove, we have a lived experience advisory group who very much partners with us, working with us on the transformation. It's evolved over time. So when it was set up about 18 months ago, it started fairly small scale. We were new to working in this way, but now it feels very much we are working hand in hand. We're driven by priorities that we hear. Everything that we're working on together from the beginning. I think that's really important. This is not about a group of people just going out with ideas and testing it out. It's doing it together from the beginning. So what's going on in Brighton and Hove is really replicated in each of the areas. So there's similar arrangements in East Sussex and similar arrangements in West Sussex. In Brighton and Hove, we have an arrangement with Possibility People, who are a local community and voluntary sector organisation, and they provide support to these experts by experience, and that's really important. It's not a question of just individuals turning up to a meeting and expecting them to be able to participate. It takes quite a lot of working with people, making sure people are supported to be able to come to meetings, and we do things in a way that suits service users. So Possibility provide that really, really important support to those individuals. And we always want to learn and develop it. So it's not a question of saying this is how we're doing it. We're constantly looking to see if we get feedback, how could we do things differently? How could we work in a way that's appropriate and engages, and really we have a system for the future that is based around needs of individuals who use services. Hope that helps answer some of that, but I'm happy to speak outside to anyone that wants to hear more about that.
Thank you, Anne. Somebody has asked just about some of the other roles that might be included within the EWS, so particularly the access facilitator roles, and are there any future plans for some band 4 roles such as peer support and so on? So is it possible to speak around how the team might grow over time?
Yeah. I'll respond to the question about access facilitators. So there are access facilitators, so this is band 3 and band 4 roles that are being recruited to across Sussex, and they're being mobilised alongside the Emotional Wellbeing Service. And these roles, some of their PCNs, if there are representatives from them here, will be aware of these roles starting to work within their PCNs, and they're specifically aimed at providing support to engage people with an SMI diagnosis that are the most difficult to engage with their physical health checks, in supporting those people to access their physical health checks and come into the surgeries, and preferably for that. So those roles, you'll be seeing roles fitting that description arriving in a PCN near you very soon, if there isn't one already. So yeah, those roles are currently being mobilised, and we've got ongoing recruitment. I think we've got we will have a total of 26 roles across Sussex, and we have 6 more left to recruit to, which we're expecting to have completed by the end of this financial year. In terms of the peer support roles, did you want to respond to that, Anne?
Yeah, I'm happy to. So in terms of peer support, I perhaps could have included it on the last slide in terms of gaps, actually. I only mentioned a couple, which was, I think, psychological therapy and pharmacy. We have many gaps in our system. So we do have some peer support in our system, but it's a bit fragmented. And the idea is, going forward, that we will look to bring in peer support into each of the EWS teams. But it's really important that we've got a kind of team forming first. You can't just drop in peer support where you haven't got a team. And again, it's really important that we've got an infrastructure to support these peer workers. And actually they're able to work perhaps at a bigger geography than a PCN to get that support. There's greater flexibility, so peer support workers with particular needs or particular expertise in particular areas can be flexible. So that is the plan, that we're working on a plan to see how we can bring that in over the next year as part of the next stage of the integration plans.
Yeah, and I just wanted to say a bit more as well about the kind of more varied clinical roles that we're looking at as well, because I'm keeping a little bit of an eye on the questions that might answer some other questions that I've seen. Some of the priorities alongside the peer support worker roles that we're identifying with our PCN colleagues is around medication advice and prescribing. So a priority role that we would look to include in the emotional wellbeing services as we develop them further would be mental health pharmacy roles that are dedicated to working within the emotional wellbeing service, and also psychological practitioner roles. So there are band 5 psychological practitioner roles that are trained to be able to offer short-term psychological interventions, but to people with added complexity that, as I've already described, we wouldn't be able to access traditional IAPT services. So there are just a couple of examples of the kind of the priority roles that we've identified that would be, you know, are really needed to start with. Thank you.
Thank you, Jenny. So there are a lot of questions that have come in. So we've only got 4 minutes left, so I'm going to try and get through as many as we can. There are some which are similar. There's been a couple of questions around how the EWS can support older adults and those with dementia. So one question was, will people diagnosed with dementia be able to access EWS? And another was around, is there any specialist service provision or a practitioner that specialises with older adults that would be able to support somebody within EWS?
I'll respond to this. You might want to add to it as well, Anne. What we're doing is we're working with colleagues from the older adults mental health service to look at how we can develop the emotional wellbeing service so that we're able to connect with services that specialise in supporting older adults. So it's an area for development. In terms of a person with dementia, this service isn't aimed at people that have a primary diagnosis of dementia. There's a kind of separate pathway and support that's available for people with a dementia diagnosis. And in terms of the further development of the service, another aspect of the EWS multidisciplinary team that we'd be looking to develop roles for as well as we identify needs within PCNs is some clinical specialist roles. So what we've identified is those roles we could see primarily with a focus on older adults or the younger adult age group, or it might be roles that are focused on dual diagnosis, and that will be dependent on the demographics and the needs within a specific PCN and how the resource needs to be focused there as we expand the service moving forward.
Thank you, Jenny. And I think we've probably got time for one or two more questions. This person here has asked, what systems are we using within EWS in terms of the information sharing between different organisations? So how are we managing, Care Notes, Plexus, System 1? How are we managing kind of that digital infrastructure to allow for information sharing?
That's been one of the biggest challenges, and it remains quite a challenge to us. We've developed various ways that we can integrate and draw together the data from the voluntary sector members of staff alongside the Sussex partnership ones for reporting purposes. But I think probably for that question, one of the kind of primary issues is being able to see on PCN systems what's happening within the emotional wellbeing service. So all of the staff that are employed within the emotional wellbeing service, they're all trained and have access to the GP clinical system for that specific PCN. So what they would be doing is putting a case note entry into the GP system in whatever format the GP service prefer that to appear, so it's visible to practice clinicians the support that somebody's accessing within the emotional wellbeing service.
That's great. Thank you, Jenny. And we are at 1:45 now, so we are going to have to wrap things up. There were a lot of questions that we haven't been able to get round to. So what I'll do is I'll have a look through the chat and try and make sure that as much information as possible is included in the background information that we send later on today via email. Also, if there was anything that you wanted to talk through in any further detail, if you can email communitytransformation@spft.nhs.uk, that will come through to the programme team, so we can then direct it to the relevant person to be able to either respond to an email or for you to be able to organise to have a chat about something in further detail. So please do that if that would be helpful. So thank you all so much for joining us today. Keep an eye out for that email to come through later on, and I hope you all have a really good rest of the week and a very happy Christmas when it arrives. Thank you all so much.
Thank you very much, everyone.